In today's podcast, we'll be discussing pediatric fever. Nothing scares parents more than a sick child. Children are brought in by parents for fever all the time. How much testing you do and how worried you are will depend on the age of the child and how well they appear during your exam. Your initial steps are the usual. Start with a quick history. Don't forget to ask things like how long they've had the fever. How high is the fever? Any associated symptoms like cough, congestion, pain with urination, vomiting, diarrhea, lethargy. Very important. Don't forget to ask about vaccination history. Also, have the parents tried anything like Tylenol or Motrin? When it comes to orders, this is really going to depend on the age of your patient. So let's break it down. 0 to 30 days are getting a full workup. This includes complete blood count, basic metabolic panel, chest x-ray, blood cultures, urinalysis, urine cultures, and yes, they all get an LP. 30 to 60 days old will probably get labs, urine, chest x-ray, and maybe an LP depending on how the baby looks and whether there's an established source for the fever. Many docs will still do everything the same as our under 30-day-old infant. 60 to 90 days usually depends on how well the baby looks, but these kids will often also get labs. Kids older than 90 days are usually vaccinated and have enough of an immune response that if they don't look sick, you can skip the labs. There are several decision rules that are used for various ages that you'll learn later in residency. Don't worry too much now. Older children will often have signs consistent with an upper respiratory infection. So if they look well, you can treat the fever and have parents follow up. For your differential diagnosis, consider things like infectious disease, meningitis, pneumonia, urinary tract infection, bacteremia, and sepsis. Overall, remember to treat the symptoms. Tylenol or Motrin for fever, and generally kids under 5 do not get cough medicine. Your disposition plan will once again depend on your patient's age. Under 30 days will always get admitted. 30 to 90 days will frequently be admitted for observation, while over 90 days will really depend on how the child looks. Thank you for listening. I hope you feel better prepared to tackle your next pediatric fever patient.